I hate to say it, but I do feel sorry for lipidologists. Lipid means fat or oil. And these guys base their whole career on the assumption that the problem with cardiovascular disease is the lipids, LDL. It boggles my mind. They never considered that maybe those lipids are really just more of a bioindicator of a larger metabolic disease. Just watch this next video. As you wade into the Lp(a) part and the lipidologist part of your story, I start to get a headache. It's like two issues. Number one, as you bring up your French-Canadian descent is a big issue, especially Lp(a), more so than for FH. And I've got a lot of French-Canadians in practice because of this issue. On the internet and you do what we do, people come to see you for that. And I can tell you, 48 is not a big deal. I mean, we get people in the hundreds, several hundred. And those are the kind of numbers where you start to see aortic valve calcification and things like that. We do have a few people that have both FH, familial hypercholesterolemia, and Lp(a), almost without exception. The vast majority of people that have FH have heterozygous FH versus homozygous. And when that's the case, it's like you. Those are issues, those are risk factors, but they're not really until and unless you develop the insulin resistance, which is associated with obesity. And it's like the same theme over and over and over again. So yes, cardiovascular disease is a multifactorial issue. Unfortunately, we tend to major on the minors and forget about what the real risk factor is. Speaking of that statement, that leads right into your experience with the lipidologist. That's when I really started holding my head because I had to share your personal story. And thank you for your patience while I can't help but interrupt.
Please do.
There's a lipidologist in South Florida that I've met that's in the Bale-Dunedin community, and I'm not going to give his name because what I'm going to say is not complimentary. But, we get CIMTs in the cardio risk group that one of the ways they're able to get access for patients for CIMT all across the country is they go to their doctors who get CIMTs and they say, Dr. Brewer has patients all over the country. He has some patients near you. Do you mind if when our CIMT tech is in your office doing your patients, they get one for Dr. Brewer's patient? And some doctors say, no, I don't want that. I've got my own, we're too busy. No. But most doctors, to their credit, say, yeah, that's great. This lipidologist, he meets with every one of my patients that come in. And he says, I know this Dr. Brewer. I've seen him on the YouTube channel, and I know he recommends low-carb diet. I see all of his patients when they come in to get their CIMT, and I'm telling you, this low-carb diet is dangerous. And it's like, how can you possibly say this low-carb diet is dangerous? Meanwhile, this doctor is north of 250 pounds himself. He's about 5'10", north of 250 pounds. And I get patients calling me time and time again. So you might say, well, Ford, that's inappropriate. Obviously, the guy doesn't know his stuff very well, and he's intervening, and he's inappropriate medically as well, that intervening with another doctor's patients. And I've called him. He does not pick up my calls. I've called him multiple times. Then I started calling Todd, and Todd, to Todd's credit, he was caught in the middle, and all he could say was, I can't believe that, Ford. That's never happened. Well, I've had multiple patients call me back and quote exactly that happened. So, pardon me, it's me frustrated, but it's my patients frustrated as well. The bottom line, if I were a lipidologist and I had spent a couple of extra years learning about lipids, when the vast majority of the times, lipids are really just a bioindicator of the underlying problem, I'd feel kind of like I'd wasted a lot of time too. I feel sorry for lipidologists because they tend to head in the wrong direction. Pardon me if that's too much of a digression, but I could not help but share it, and I appreciated your story in that space. You had the same example.
Well, there's a little bit more to my story in that the lipidologist I went to, the very first visit I had with him, when I walked in the door, he said, I've already written up your file. He'd never met me, but he had diagnosed me with familial hypercholesterolemia, which I don't think I would have even qualified for on total cholesterol. I had peaked out on keto at about 240, but that was going on keto, and my history certainly didn't show much over 200. I was in the 130s for LDL, something like that, and it's not great. but it's not familial hypercholesterolemia. So he said what was it, heterozygous?
Yes. So he said heterozygous FH.
Yes, he diagnosed it. In fact, it's still on my file, and I keep taking it off. It just doesn't come off. It's very sticky once you get a diagnosis like that. And he did the Framingham thing, and I said, but doc, I lost all this weight. I'm in better shape than I was, obviously. My blood pressure's down 20 points, and I'm doing pretty well. He says, that doesn't change anything. You still have a 75-year-old heart, which might have been confirmed. I don't know when I had these other scans done. But he struck me as arrogant, and he struck me as somebody who didn't have any interest in listening to me. So that's just to wrap up your story on lipidology. After doing all these tests, I ended up on a rosuvastatin 10 and ezetimibe. And my numbers from that point on just got nothing but good as far as lipids go. My ApoB was 50 and my HDL had gone down to 54, but you look at the ratio, it's still 1-to-1. Trigs were 50. And as I told the fellow I went to last week, I seem to have the lipid part dialed in. Now I want to learn about the inflammation part.
Looking to improve your health and add decades to your life? Join me in the PrevMed team December 1st and 2nd in Tampa, St. Pete for the Heart and Stroke Prevention Event. This is an event, not just a conference. You'll not only learn how to prevent heart attack and stroke using my battle-tested methods, you'll also access accurate, predictive testing that the majority of physicians never use because they don't know how. All you need to do is click the link below this video or simply go to PrevMedHealthTampa.com to sign up. Hope to hear from you. Thanks.